A prominent World Health Organization advisor has warned that more Ebola cases can be expected among medical staff, even in developed countries with modern healthcare systems. Professor Peter Putt said he was not surprised that a Spanish nurse had contracted the disease. The nurse has become the first person known to have contracted the deadly virus outside West Africa. She treated 2 Spanish missionaries who died of Ebola in Madrid. The nurse, identified in media reports as Teresa Romero, looked after the pair after they were repatriated from West Africa. She remains in quarantine in the Spanish capital along with her husband and 3 other people. Another 50 people in Spain are being monitored. The nurse told Spain's El Mundo's newspaper on Wednesday that she had followed the correct protocol and had no idea how she had become infected. She said she was feeling a little better but was very tired. The 5th person to be placed under quarantine, who is reported to be a friend of the infected nurse and also a member of the Ebola care unit at the same hospital, was admitted on Wednesday morning with a slight fever. The BBC's Lucy Williamson in Madrid says hospital staff reported scenes of panic at work on Tuesday, with some people crying and others leaving the premises. Spanish media say neighbors of the infected nurse have been calling emergency services, asking how to protect their children after sharing lifts and public spaces. In another development, the woman's husband is reported to be fighting a court order to have their pet dog put down over fears that it could be carrying the disease. Animal rights groups have also criticized the move, saying there is no evidence that Ebola has been spread by dogs. Some 3,400 people have died in the current Ebola outbreak, with most of the deaths in Guinea, Sierra Leone and Liberia. The hospital was reported to have had extreme protective measures in place, as UPM reports. Liberia's ambassador to the U.S., Jeremiah Sulenta, told the BBC more treatment centers and ambulances were desperately needed. The International Monetary Fund, IMF, has warned of dire consequences for economies in the region if the virus continues to spread. The European Commission has asked Spain to explain how Ms. Romero, a 40-year-old auxiliary nurse, could have become infected. A hospital investigation is underway. She was one of about 30 staff at the Carlos III hospital in Madrid who had been treating priests Manuel Garcia Viejo and Miguel Pajeres. She is believed to have caught the virus while caring for Mr. Garcia Viejo, 69, who died at the hospital on 25 September after catching Ebola in Sierra Leone. Mr. Pajeres, 75, died in August after contracting the virus in Liberia. Ms. Romero had twice gone into the room where Mr. Garcia Viejo had been treated, to be directly involved in his care and to disinfect the room after his